So, if you work in a dental practice, you know one of the hottest topics and confrontations with patients is x rays, those radiographs. So, when a patient comes in, what are you doing to educate your patient on why you're taking those x rays and how much radiation are they actually receiving? That's one of the most important questions you can ask yourself today is, am I doing everything that I need to do as a dental professional to educate the general public, my patients, when they come in? So let's talk about one of the first things we want to do is educate your patient on why are we even taking these x-rays, right? Like they a lot of times they think it's a money grab that an office is just doing it to bill the insurance. No, that is not the case, right? We need to see things that we can't see with the naked eye. So, what are some of the reasons we're taking these x rays? Well, number one, we're looking for decay in between the teeth. As we know, dental professionals, the most common x rays that we're taking is those bite wing x rays to check for those interproximal surfaces, those flossing areas for patients. When a patient comes in, that's what we're doing for those checkup x rays. And then, of course, from there, if we're seeing anything additional, then we're taking periapicals because we want to check and see what's going on with the roots as well. And then if your patient has a chief complaint, it's always a great idea to take a periapical on top of that as well. So, in addition to that, we are checking for bone loss. So obviously, the hygienist is the expert in this field, and they're educating the patient when they come in for their checkups. But we want to ensure that we're doing that as well. So we are checking for bone loss when we're taking those X-rays, ensuring that the bone is at the level where we want it. And if we are seeing some bone loss, we're educating our patients on what is happening and what we can do to prevent it from further progressing. So we're also looking for decay under an existing work. Now, obviously, we can't see under those crowns. It's difficult with the metal, but we're checking for existing restorations. We're making sure that everything looks okay. So once again, we're not scamming anybody. We're checking a couple different things when we're looking at x-rays. Going back to those periapicals, if we're taking Panorex, we're taking a full mouth series, individual periapicals, we're looking for infection at the tip of the root, around the apex. We want to make sure everything looks okay. Just because you're not having pain doesn't mean that something is not going on. So sometimes we're looking at things, trying to head them off at the pass. And anytime a patient comes in, we want to check x-rays to examine the area before a procedure. So if we do not have an up-to-date x-ray, that might be another reason why we're taking x-ray. I know a lot of times we would have a referral, or even we would have to do root canal treatment, and patient would come in and all we would have is a bite wing. So at that point, I immediately would take a periapical because I know that the doctor needs to see the whole tooth, right? So that's the whole point of when we take these x-rays. So if you are a dental professional and taking x-rays, I would also advise there's a great couple of graphics, and I'll put them at the end of the video here so you can screenshot them. Feel free to uh, drop a comment below, reach out to me. If you send me your email, I can certainly have the company send you them an email so you can print it off, have a nice copy to hang up and educate your patient. So it's a great graphic. It explains to the patient how much radiation they're actually receiving in comparison to some things that they're familiar with as far as daily life goes. So, like I said, I'll drop that at the end. But certainly, if you have questions as to helping better educate your patients, feel free to reach out. And I hope that you are doing these things when you're talking to your patients. And any other questions, like I said, feel free to comment below, drop us a message, and we will help out as best we can. Hope everyone has a great day, and thanks so much for joining in.